Welcome to Henle Care Radio, where we present a variety of topics in the vast field of nephrology. Loop diuretics are a class of medications that play a crucial role in the treatment of various conditions, including hypertension, heart failure, and edema. This episode will delve into the mechanism of action, pharmacokinetics, indications, and side effects of loop diuretics, focusing on their technical aspects and clinical applications. Loop diuretics, such as furosemide, bumetanide, and torsemide, act by inhibiting the sodium-potassium 2-chloride cotransporter, or NKCC2, in the thick ascending limb of the loop of Henle in the nephron. This cotransporter is responsible for the reabsorption of sodium, potassium, and chloride ions from the tubular lumen. By blocking NKCC2, loop diuretics prevent the reabsorption of these ions, leading to increased excretion of water and electrolytes in the urine. This mechanism results in a potent diuretic effect, reducing fluid volume and decreasing blood pressure. Loop diuretics are rapidly absorbed from the gastrointestinal tract, with peak plasma concentrations occurring within 1 to 2 hours of oral administration. They are extensively bound to plasma proteins, primarily albumin, and are distributed throughout the body. The elimination of loop diuretics occurs primarily through renal excretion, with a small portion undergoing hepatic metabolism. The half-life of these medications varies, with furosemide having a half-life of about 2 hours, while torsemide has a longer half-life of up to 6 hours. The duration of diuretic action is typically 4 to 6 hours for furosemide and bumetanide, and up to 12 hours for torsemide. Loop diuretics are indicated for the treatment of various conditions. They are effective in reducing edema associated with heart failure, liver cirrhosis, and nephrotic syndrome. These medications can be used as monotherapy or in combination with other antihypertensive agents to control blood pressure. In patients with acute kidney injury, loop diuretics can be used to promote diuresis and manage fluid overload. In patients with chronic kidney disease, loop diuretics are used to control hypertension and manage fluid balance. While loop diuretics are generally well tolerated, they can cause several side effects. Excessive diuresis can lead to electrolyte imbalances, such as hypokalemia, hyponatremia, and hypomagnesemia. Overuse of loop diuretics can cause dehydration and hypotension. High doses of loop diuretics, particularly when administered rapidly or in combination with other ototoxic drugs, can cause hearing loss or tinnitus. Loop diuretics can increase serum uric acid levels, potentially exacerbating gout. In rare cases, loop diuretics can cause interstitial nephritis or acute tubular necrosis. Loop diuretics are a potent class of medications that play a vital role in the management of various conditions characterized by fluid overload and hypertension. By understanding their mechanism of action, pharmacokinetics, indications, and side effects, healthcare professionals can optimize the use of these drugs to improve patient outcomes while minimizing adverse events. As with all medications, careful monitoring and individualized dosing are essential to ensure safe and effective use of loop diuretics in clinical practice. Thank you again for joining us here on Henle Care Radio.